Your Parkinson's, how long do you had it?
15 years.
15 years?
15 or 16 years.
Okay. And what are some of your symptoms that you have for Parkinson's?
Trembling like this.
The tremors?
Yeah.
Okay. And it's mainly on your left side?
Yeah.
Okay. And you were telling me a few minutes ago you have headaches?
Yeah.
Can you point to where your headaches are?
Yeah.
The base of the skull on the right side. And where else do you have pain?
Right temple.
Okay. Do you have any ear issues? Ringing in your ears?
None.
Stuffiness?
None.
Dizziness?
No.
No
Oh,
dizziness?
No, I have dizziness.
Okay. Any other symptoms you want to tell me about?
Go to the bathroom so often.
Do you go to the bathroom? How often do you go to the bathroom?
Oh. All the time.
Okay.
Let's see, he went when he got here, and then he just went again.
Okay, so like within an hour?
Twice as many times as most of us.
Okay. Okay. Now, as far as sleeping, what time do you normally go to sleep at night?
I wait till like 9 o'clock.
9 o'clock you go to bed?
Yeah.
And then how many hours do you sleep on average?
About 4 or 5 hours.
4 or 5 hours. How many times do you wake up in those 4 to 5 hours?
So 6 times.
This first patient has an almost normal gait. You can see the rest tremor in the right arm. However, his stride length is normal, as is his arm swing. He only has minimally stooped posture. This second patient has more significantly stooped posture and a decreased arm swing on the right. However, his arm swing on the left and his stride length are quite normal. This third patient has decreased arm swing bilaterally. She has much more decreased stride length. And you can see here the turning on block. This last patient has more significantly decreased arm swing and stride length, but again is walking with little difficulty. These three patients show more significantly affected gait. They all have idiopathic Parkinson's disease. This first patient is probably the most affected. His stride length and arm swing are very decreased. There you can see this turning on block. He also had some slight freezing in that turn. The amount that his stride length is shortened and the festination interfere with his gait, making it difficult. Therefore, I would rate that a 2 on the UPDRS. This second patient has decreased stride length and some dystonia in the neck, which make his gait somewhat difficult. This third patient shows the response to medications that can happen in Parkinsonian gait. First, here we see him with significantly stooped posture. And then next with meds, he has better stride length, and although his posture is still affected, is improved somewhat. These three patients show severely affected Parkinsonian gait. This first patient actually has a diagnosis of multiple systems atrophy, or MSA. You can see the difficulty she has rising out of a chair, even needing assistance using her hands to push up. When walking, she is unable to walk without an assist device, here her cane, and has much difficulty taking any steps. Once she's out in the open, she fares a little better. However, her shortened stride length and severe truncal dystonia, here leaning towards the right, which could be described as Pisa syndrome, which is frequently seen in MSA, are causing her severe gait disturbance. This second patient has idiopathic Parkinson's disease and is off his medications. We can see that he needs full assistance to stand and is unable to even take 1 or 2 steps in his gait. This last patient demonstrates the postural instability seen in some Parkinson's patients. On pull test for balance, she has complete lack of postural responses and needs to be caught by the examiner.